there is a word of advice that you can give any of your friends or patients or colleagues, what would that be?
Well, there are several words of advice. First of all, never think that it cannot happen to you. So I think it's important to know your baseline. Ask for a DEXA as soon as your health plan allows it. And if there's a family history of some sort, you ask for it before then. You speak to the family history and you go and you make sure that it happens. I had no signs or symptoms that I recognized, but, so I thought that since I was a healthy eater and exercised kind of regularly, I was fine.
Right.
The other thing that I would say too is not to buy into the myth that only older white women are at risk for osteoporosis, because that is the myth that's out here. And so certain medications can reduce bone health. And within the Black community, a lot of people are taking diabetes medications, high blood pressure medications, and they've been taking them for years and years and starting young. And so this process of bone loss happens quickly or earlier, at an earlier age is what I'd like to say. There are two other points I wanted to make in terms of what would I share with other people. Because the real sign or symptom might be a fracture, in terms of osteoporosis, we need to know what is going on silently in our bodies, because this disease can be ravaging our bodies very silently and we don't know anything. So it's very important that they do get the baseline. And I had said that before. And do it when you, as soon as you can. And then never underestimate, this is for me, the power of stress. I feel that stress played a huge role in my diagnosis, because for the last years before 2018 and 2018, with the downsizing, I was a caregiver for my mother. I was raising a teenage daughter. I was running a business where I took care of other people too. So we do so much for others, and that's what happens, I know, within the Black community, Black women, we do a lot for others and sometimes don't take care of ourselves the way we should. So those are some of the things that I would say to someone as advice to help to avoid this osteoporosis diagnosis.